I am Dr. Ayodele Olagunju. I'm a consultant obstetrician gynaecologist. I trained as a medical doctor in Olabisi Onabanjo University. I did my internship at University College Hospital, after which I now proceeded into residency training in obstetrics and gynecology. And I've been practicing obstetrics and gynecology for over 10 years. My interest in O&G actually started from punishment. I was punished. I was a group leader when I was a medical student. And it was funny because most of the time when we do ward rounds, as the group leader, I must always be on ground. I noticed that all the postings we did, it was only O&G that would have soft drinks and snacks to serve students. Because you know, when people deliver their babies, they want to sell, especially women who are delayed before discharge. They will do their naming ceremony in the hospital. So they come with soft drinks and snacks. When you go to medicine, you don't see that. When you go to general surgery, you don't see that. Pediatrics, but you know, O&G, then I also love the cordiality between nurses and doctors. They play a lot, they intermingle. Now, to now cap it up was one particular day, I was with my group members. And you know how medical students are. Some over-sabi people were informed that the consultant was operating a patient in the theater, and they left to go to the theater to join the surgery. We were not aware. So we were monitoring contraction in the labor ward for close to 2 hours. When the consultant now came out, he now met us monitoring contraction. I said, Olagunju, what's happening? You are the one that detained your team members here. The serious ones joined me in theater. I said, we are not aware that. He said, no. So the punishment is that all of you that stood back must pack in into the hospital and start doing continuous call until you are forgiven. So we packed into labor ward and we were doing call. Day one, day two. So all through that period, we were conducting delivery. I was watching, I saw breech presentation. I now loved it so much. I love this. And it was my first time of seeing breech delivery, and it was interesting. The third day, the consultant came to free us, but that mindset of obstetrics and gynae had been deeply imprinted in my spirit. I love this obstetrics and gynae. Interestingly, when we now did outside posting, we call it COBMES, Community-Based Medical Education and Service Program. Do you know that I intentionally put myself on calls severally just to be able to conduct delivery? And before I left that posting, I had taken 35 deliveries unsupervised. So it was so interesting. Now, reproductive health is important for both men and women, especially when it comes to medical practice, because you want to give autonomy to every individual that God created to be able to make up their mind on choices as regards reproduction. How many children do I have? When do I want to start having these children? When do I want to stop having children? So if you want to have children and you're having challenges in achieving conception, that is a problem. Or you now have children and you want to stop, and you cannot stop. Now you're having 7 children. You want to stop, you're having the 8. That is a big problem. So it's important. Then when it comes to reproductive health, especially problems relating to sexually transmitted infection, it's important also that specialists regarding these are able to give care to prevent problems that may get transmitted from one person to the other. So you cannot downplay reproductive health for any reason. Then, like I always say, pregnancy is not a disease. It is a physiological condition. There is no reason why a woman should get pregnant and die from pregnancy-related condition. It is not a disease. So you need specialist input in the care of your woman in labor or in pregnancy, so that the outcome will be a favorable one. You having live baby and a live mother after the journey. I've seen majority of women have problem relating to achieving conception. And also some of the problems are also problems that are pregnancy related and some related to delivery. Let me start with the first one I talked about, which talks about achieving pregnancy. A number of times, problems that lead to infertility have actually been showing their faces right before the woman even got married, but a lot of us don't pay attention to them. For instance, a woman that is having abnormal discharge, vaginal discharge, and she abandons it and or goes on to take medications without seeing a specialist, these infections may ascend up to the upper genital tract and result into blocking of the fallopian tubes, which can now be a problem later when they get married in achieving conception. A woman who just notices that her voice is now becoming deeper, she's beginning to have male pattern of hair distribution. You are seeing mustache, you are seeing beards in a woman. When you look at the tummy of a woman, you are seeing male pattern of hair distribution. Normally, the hair of a woman should be like a triangle that is facing down. By the time you are seeing diamond-shaped hair distribution in the abdomen of a woman, or hair distribution that has a tail coming towards the chest, all these are male pattern of hair distribution. It is telling you that the woman may not be ovulating. In a situation where you are having a woman who is telling you that I'm feeling hot from the inside, it can tell you that there may be problem with ovulation. Or you notice that when people are complaining that they are cold, you are always hot. Or when people are saying they are hot, you are cold. This can tell you that you are having thyroid dysfunction, or you are having excessive obesity. You are having so much weight gain, or you are having acne. You are having facial acne. All these are evidences that you may be having problems with ovulation. So these are things that one needs to pay attention to. That's in terms of achieving conception. Now, in terms of pregnancy, some people have some medical disorders which should have been properly managed before attempt at achieving pregnancy to start working on that. What do I mean by that? Somebody is hypertensive or diabetic, and this person does not control his blood sugar before achieving pregnancy. That kind of woman in pregnancy, the journey will be a turbulent one. So that's why something we call preconception care should start. We don't practice that so much in Nigeria. Most people just go for antenatal care. There should be a preconception clinic, which I practice in my hospital, Popular IV Medical Consultant. If you are ready to get pregnant, we evaluate you. If there's any medical disorder, we control it, then you start getting pregnant. That makes the journey through pregnancy a smooth sail so that you can have a good delivery. The thyroid gland is a small organ that is found on our neck. Medical doctors call that area anterior mediastinum. It does have some part that extends to our neck. Now, this gland, what it does is that it releases thyroid hormone, and this thyroid hormone is responsible for us making us sharp, making our work more efficient, and making our metabolism, the way our body works, it makes the work more effective. However, for one reason or the other, which may be related to our diet or some genetic diseases or autoimmune disease, that's body fighting itself, you will notice that some people have very elevated thyroid function. So they begin to have elevated thyroid hormone in their blood. This kind of symptom that we start having is palpitation. That's awareness of heartbeats. You start seeing that the person will be having awareness of heart, difficulty in sleeping. The person will be eating so much, yet he's not having weight. He will be having excessive sweating. When the person is sitting, he will be having tremor. And you won't be able to explain why this person, either the man or the woman, is having tremor. You may also not be able to tell why it appears that the neck of the person is swelling up. So we call it goiter when you see it. Those kind of symptoms are related also to menstrual irregularities. So the woman will begin to have irregular menses, problem of ovulation. And if the child that is coming is a promised child or a child of destiny, and even with your thyroid gland you still get pregnant, you are very likely to have a miscarriage, because thyroid hormone that is deranged can result into miscarriage. So these are some of the things we can have. If thyroid hormone is now very low, we call that hypothyroidism. That kind of woman will start sleeping excessively. You may begin to sleep for more than 12 hours in a day. You will start adding weight. There will be slow menstruation and so on. So these are things that one needs to attend to when one wants to achieve conception. What men should understand about their reproductive and sexual health is that 30% of the time when there is no pregnancy, the problem is from the man. Men have this problem of unnecessary ego. When there is no pregnancy in the family, the man will tell you, I am not the one who has a problem. Madam, you are the one, go and seek for assistance to solve your problem. Whereas it may be the man that has the problem. Some men will go to the extent of saying they impregnated 3 people when they were in school. So I don't know why you are not getting pregnant. I think the problem is yours. But listen closely. Every mother in the house also listen to this. Every male child you have, your assignment today, take them into one corner and check their scrotum. Do you have the 2 testicles inside the scrotum? Before we were born, our testicles was inside our abdomen, but they descended down along something we call the inguinal canal before they now entered into the scrotum at birth. So if you have a preterm delivery, you are at a risk of having testicles still inside the abdomen and not descending down. And some men are born 10, yet their testicles still did not descend. We call that undescended testes. Those kind of men may have problem with sperm production, and that can be a problem. And if that is the case, you need to see the doctor on time so that it will not escalate to become bigger problem. Other problems you can have is that men are very careless. When you have sex, especially prior to marriage, hardly do some men use condom, and this exposes them to having sexually transmitted infection. The most notorious one we have in sub-Saharan Africa is Neisseria gonorrhea disease. The man will just come to you as the doctor, hello doctor, good afternoon sir, I have toilet disease. This your toilet disease, how does it manifest? He will tell me, when I want to urinate, it's something white that is coming from my penis and I have difficulty urinating. And uncle, it is not toilet disease. Yoruba people call it disease of the wealthy, àrùn gbajúmọ̀. That's what you have. What does that mean? It means that the disease has entered into your genital tract and it is bringing out pus. That white thing you are seeing is pus. And if you want to force urine to come out, you begin to see blood coming out from your urethra. The implication of that is that if it is poorly treated, it will block the vas deferens, the area where sperm, the pipe that carries sperm from the epididymis, will be blocked, and the person will have something we call obstructive azoospermia. That is, when the man has sex later in life and semen comes out, that semen does not contain any sperm at all. Not that the testicle is not producing sperm, but the problem is that there is now a blockage to the pipe, so sperm cannot come out. So these are some of the things men need to pay attention to. Protect yourself, practice safe sex. When we say safe sex, the normal sex we know, because sex has several definitions. You can have genital contact, that is sex involving the 2 genitalia, that's the man and the woman. You can have orogenital contact, now which Africans are beginning to adopt from movies that we are seeing the people of the Western world practice. So orogenital contact. Now people are now beginning to talk of contact of animal with their genital tracts. And so these are things that are unsafe sexual practices. So when you are practicing all this, you need to be more careful, because chances of transmission of sexually transmitted diseases becomes higher with all this practice.